The blue wedges, these agencies have enforcement responsibilities, and these agencies here provide support to those agencies in a pesticide incident. And each agency plays an important part in regulation, incident response, and protection of our citizens, wildlife, and environment. One important point to remember is there's no wrong door to report an incident. If you're working with or have a contact in any of these agencies, you can report the incident to them, and the incident will be forwarded on to Park, and then to the appropriate agencies to respond. Next, please. So, as with any serious incidents, there are some things that you should do. So, in the case of pesticide exposure, the first thing that you want to do is to get help if someone is sick or injured from that pesticide exposure. You want to call 911. You can call the Oregon Poison Control Center. They're staffed with experts who can help, and they can also help your physician as well. They're a great resource for physicians. Again, call those folks or call your healthcare provider. You want to leave the area as soon as you can if there's an ongoing exposure. Try to wash that pesticide off of your skin or your hair if that was exposed. If you get a chance, write down that key information, and that will be helpful not only for your physician but for the investigating agencies, and then report it. You can report it directly to Park, and here's the number here, 844-688-7272. Next, please. So here's what to expect if you report an incident to Park. So remember, there's no wrong door, and Park will respond to you and investigate. Please note that several agencies may be working together with investigatory or supportive roles in that response. Next, please. So I'll switch gears to Public Health Division programs. And Public Health follows up on select reports of acute pesticide illness and injury, specifically reports involving a death, an interaction with a healthcare provider, work-related pesticide incidents, events involving 2 or more individuals, or a referral from Park. Again, we assist the Park agencies both during the course of investigations as well as through efforts to understand trends in the causes of pesticide-related illness. We also provide data to the Centers for Disease Control and Prevention to aid in national level scientific and policy-making efforts when resources permit. So laws regarding pesticides specific to the Public Health Division direct healthcare providers to report cases of pesticide poisoning to us within 24 hours. Next, please. So then, when we in Public Health receive a report of pesticide exposure, whether that's from a healthcare provider or from the individuals themselves, we interview the patient to try to determine what exactly they were exposed to, what were the circumstances related to the exposure, as well as when the symptoms began relative to the exposure and how long those symptoms lasted. We consider the illness or injury to be acute if there's a skin-related symptom, an eye-related symptom, 2 simultaneous symptoms related to a whole body system like the respiratory or gastrointestinal systems, or if the case was referred to us from Park. You know, there's a multi-agency response in place. Now, our method of public health case follow-up allows us to identify links between the symptoms, the nature of the exposure, and the nature of the pesticides. We're also able then to contribute both to state and national efforts to understand trends in the causes of pesticide-related illness and inform policy-making efforts. Now, it's important to note that we have limited resources to do this work and no resources dedicated to identify unknown pesticides. nor conduct field investigations of emerging events. In fact, our partner agencies, in part, are best suited for those roles. Okay, so here's a little information regarding what we do know about pesticide releases and related illnesses, or acute pesticide illness and injury data. So you can see that the vast majority, 60 to 70%, occur in the home. Most of these are accidental self-exposures or bystander exposures involving residents, neighbors, and pesticide applicators. Next is farm-related exposures, and then you'll note that forestry-related releases and reported illnesses account for about 1% of the total. Next, please. We also know that there are more cases of acute pesticide-related illnesses among adults aged 50 to 59 than in other groups. All right, so let's shift gears a moment to a large-scale exposure or multi-household events, like where we started the evening out, like the event experienced by the residents of Cedar Valley in Curry County. One of the lessons that we learned in public health is that while we had established communications channels with our partner park agencies to aid in the ongoing investigation, our efforts to communicate with the local public health department didn't translate into effective communications with local healthcare providers. So as a result, we've developed a standard operating procedure that guides our communication efforts to local public health to inform healthcare providers in the area so they could be alerted that folks may come in with symptoms potentially related to this event. And then we would also work with local public health to help inform the community so they could be aware of the situation and know what they can do. Finally, our role in communications extends to public health outreach, both with people reporting pesticide illnesses and with healthcare providers treating their patients. For your information, healthcare providers regularly contact the Oregon Poison Control Center whenever they have a suspected case of poisonings of any kind. And the Oregon Poison Control Center is well equipped to assist healthcare providers and the public in understanding treatment options for poisoning. And with that, I'd like to take this opportunity to thank Beyond Toxics for inviting us to this event, and thank you also to Umpqua Watersheds for hosting, and the library as well. Thanks again.
Thanks very much, gentlemen. Time, questions on the way. For Oregon Health Authority, how would Senate Bill 613 be to your enforcement?
I guess the short answer is at this point in time, the Oregon Health Authority has no enforcement responsibilities relative to pesticides.
How about that? Please discuss endocrine disruptors like atrazine in terms of not following the traditional dose response models.
Right, so those non-monotonic dose response curves that I showed on the graph, endocrine disruptors are not the only kind of toxins that do that, but those are some that do, and not all of them. But I mean, I guess the basic idea is that it makes it just more difficult to figure out where exactly the threshold is, where no toxicity would be expected. Part of the problem too is that traditionally, like, pesticides are tested at higher doses, not at doses where people are actually exposed. So they see a response in the animals at some high dose, and then they have to sort of extrapolate from the last dose they tested down to the level where people are actually exposed. And so there's some uncertainty about the shape of what that dose response curve does at the lower doses below the last dose tested. So not sure exactly what else to say about that. And endocrine disruptors, in case people don't know, are they're chemicals that can alter the way that the hormone system works. And that's important because many systems in human development are dependent on hormones working the right way and firing at the right time and in the right amount. So if you alter that balance, it can cause there's a potential for permanent effects to occur when a baby is being developed, so that even though the exposure isn't happening, they might, as they grow up, it might have a permanent effect. It may not be apparent until later in life.
Thanks. One more question for them. I'm getting a headache and I'm not even exposed. David, how long before these chemicals break down and become inert, like glyphosate, atrazine, 2,4-D?
It depends. It depends, I guess, where you mean. If the question is about out in the environment, like when it's out like on the ground or in the air, then I would wish that someone from Department of Environmental Quality was here, because they're the experts in that kind of environmental fate and transport. But in the body, they are very short-lived. So, I mean, people have discussed already here urine testing or blood testing for herbicides, and one real challenge with that is that within 24 hours, 48 hours, it's all gone from the body. So if you were to really find it, you'd have to have that sample collected really soon after the exposure happened, or else you wouldn't, you probably wouldn't find it. So, yeah.
One more question. Has Oregon Health Authority notified all the hospitals in the Roseburg light area after the recent exposure of the logging crew on March 27th?
No, we have not notified all the hospitals in the Roseburg light area after that recent exposure. We're getting in touch with the local health department.
Have you heard?
Louder?
No, we have not after this specific event.
What have you done?
We have not, to answer this question, we have not notified all the hospitals in the Roseburg area after this particular event.
Have you done anything?
Had you heard of it? I mean, had you heard of it?
Yes, I've been briefed on it.
From these two gentlemen, thank you very much for coming here and for thank you for all our presenters. We did say that this would go until 9 o'clock. We don't want to keep anybody past that. We do have a number of questions that were given to us. And those of you, I'll have to ask your guidance, Lisa. Those of you who want those questions answered, we probably depend on our guest speakers to stay. Lisa, any guidance on that? It's 9 o'clock, so.
People can leave, or if they wish, or if you want more question answers, we can hold all the panelists to the front and leave as we go.
You've been a great audience. I'm amazed there are 100 people here, and you stayed for a very long evening. Thank you very much.